Hi everyone, hope you're doing well and everything is fine with you. So ADC did make certain changes into how they conduct the exam in regards to the initial assessment, the written exam, as well as the practical exam. And this is going to be followed for all the candidates from 2026 onwards. And I'm going to discuss them because we get a lot of questions from candidates in regards to the changes that the ADC has made, and we'll discuss them so that you have clear clarity and then you implement these changes in your future exams, whether it's the written or the practical exam. All right. So we're going to go through the changes that the ADC made. Make sure that you watch this video, understand the changes, because most of the changes that the ADC has made is actually in favor of the candidates who are appearing for the ADC exams, whether it's the written exam or the practical exam. All right. So let's get started. So the first change that they have made is that they have made changes to the initial assessment. So what the ADC did is that, as they quote on their website, in November 2025, the ADC changed the way in which we process application for general dentist. We removed the registration and skills assessment option from initial assessment application sub-application type. We made this change to ensure we collect information when and if we need it to process your application. So what does this basically mean is that any candidate, any new candidate who's starting the ADC journey, they have to go with the option of a registration only. ADC has removed the registration and skills assessment sub-application type. So you're only left with the option of registration. Now, what does this mean for the candidates? It basically means that the number of the documents that you need now for registration only is a bit less compared to if you were going for registration and skills assessment. The other reason why this change has been implemented is because skills assessment was something that you needed after ADC. Once you clear the practical exam, you receive the after registration certificate, which is basically your eligibility to practice as a dentist in Australia. So now you need the visa, right? But what happens, which the ADC noted along all these years, is that some candidates, for example, if they are already in Australia on a student visa or spouse visa, and by the time they're done with ADC, they have a permanent visa with them, or they are already a PR holder or a citizen by then. So you don't really need to go through skills assessment. So that's the reason why ADC decided that let's just do registration only now for all candidates. And once they clear the ADC, if they need a visa to move to Australia and they need the skills assessment certificate, we're going to conduct this additional step for them later on if required. Like I said, some candidates, by the time they're done with ADC, they already have a permanent visa to stay in Australia. So they don't really need the skills assessment. For those candidates who need a visa to move to Australia will need skills assessment, and they can apply later once the ADC examinations, the process of the ADC examination is done for them. All right. Because it goes on to say further, the skills part of the registration and skills initial assessment is required when a candidate needs a visa for migration purposes. However, if you migrate to Australia over the course of your ADC journey, you may never need a skills assessment. Also, a skills assessment is only required for certain Australian visa. At the completion of the ADC assessment process, the ADC will contact you to check if you need skills assessment, and if so, provide information about what we require from you. Requests submitted within 12 months will be processed free of charge. So once hopefully you're done with your ADC examination, both written and practical, and you apply for skills assessment at that time, they won't charge you additional fee for this. So they're going to give you a skills assessment certificate, which you can use for migration purposes for certain visas when you would like to move from part A or part B, any country you are, to Australia. All right. So now onwards, any candidates who's going for the ADC examination, they have the only option available with them is registration only when they are doing the initial assessment on the ADC Connect account, which is the account that you create for initial assessment on the ADC website. All right. So it has become pretty easy, pretty simple, and pretty faster now, because the number of documents that you need now is much less. All right. So please remember that this change is implemented because we receive a lot of candidates questions, messages, whether we have to do registration and skill assessment. So ADC has just clarified it and said that it's only registration that needs to be done. All right. The other change, updates to therapeutic guidelines. Now in September 2025, ADC released the new version, not in fact ADC, but ADA, which is the Australian Dental Association. They released the new version of therapeutic guidelines, oral and dental. And this is going to be followed for all the written examinations across all dental professions starting from March 2026, which means even for the March 2026, ADC will follow this therapeutic guidelines. All candidates who are enrolled in our courses, they already have access to this file in the form of the actual PDF therapeutic guidelines as well as notes and revision files, because that's what we implement. If there are any changes with ADC and examination, we straight away implement that in our courses. For practical examination, the updated guidelines will come into effect from period 2, because the practical examination is divided into 3 periods, period 1, 2, 3. So any candidates who is going for the practical exam in period 2 and onwards, which means period 2, period 3, and any examinations after that will be following the updated therapeutic guidelines, which is the version 4. Now, please remember that the version 3 and the version 4 are very similar, except that the drugs recommendation for certain condition, certain new topics have also been added to version 4, which is tremendously helpful for candidates to improve their understanding. All right, and certain medical conditions, patients with kidney failure, liver failure, infective endocarditis prophylaxis, penicillin allergy patients, their drug of choice has completely changed in version 4. So please make sure that candidates who are going for the written exam in March and onwards should follow the version 4. All right, and the same goes for candidates going for the practical examination in period 2 and onwards, should be following the therapeutic guidelines version 4. With respect to the practical exam, I won't say that this is a significant change, because in the practical examination you're not really in need of going through the entire therapeutic guidelines, because there's very few cases that actually relies on therapeutic guidelines, probably the dosages of certain medications, that's it. And also that's not really asked in the practical examination. They just need you to tell the name of the medication, so you'll be following the version 4 for that. But yes, for the written examination, there is a significant lot of information that the candidate needs to know. All right, other significant change, the extension of the written examination validity. This is very important and actually again very helpful and in the favor of the candidates, because the written examination, once you are done with the written examination, it will be valid for 5 years from now. So during this 5 years, you have the time to appear for the practical exam and clear it. Before, this was 3 years. Now you have 5 years, which means that you have multiple opportunities to sit the practical examination and hopefully clear it in this 5 years time. All right, and this change applies only going forward from 2026. All right, so any candidates who clear the exam from the written exam from March 2026, this validity extension would apply. All right, other changes to the practical examination, removal of the amalgam tasks from period to 2026. So any candidates who's going to sit the practical examination in period 2, 2026 and onwards, there will be no amalgam restoration task in the exam anymore. Again, a huge favor, or this change is actually in benefit to the candidates, because amalgam task was one of the most difficult tasks, caused a lot of frustration to the candidates, because this is something that you don't do routinely in your day-to-day dental practice. So ADC has decided that after 15 years, let's put a stop to amalgam restoration, because they're not actually done clinically. No dentist across the world does amalgam fillings anymore as such. They're still used in certain government setups, even here in Australia, but in the examination, there is no the amalgam task is no longer going to be asked, which is good. So candidates sometimes ask me what is going to happen to that task. So I believe what is going to happen is that because in the composite restoration, you used to get either a class 2 or a class 4 composite restoration. Now what the ADC is going to do is that they're going to ask both class 2 and class 4 in the practical exam. All right. Now coming on to the other question that we get from the candidates is that if the amalgam task is removed from the technical day of the practical exam, that means that any question or any case related to amalgam is also removed? Not really, because all the cases that you will see in the communication OSCE, you will see patients presenting with old amalgam fillings, right? So that also actually happens in clinics here. I personally see a lot of patients with old amalgam fillings which needs replacement, or there is recurrent decay beneath the filling where the pulp is involved. The patient is coming with irreversible pulpitis or apical periodontitis. So you still see these patients a lot in your clinical practice. So ADC is not going to change the communication cases which has in relation to something with amalgam. It's just the practical technical day task which is going to be changed. That doesn't mean that the questions regarding amalgam are not going to be asked in the written exam or in the communication OSCEs of the practical exam. All right. Then you have a change which says introduction of new teeth from period to 2026. So what the ADC decided is that they're going to introduce new high performance simulation teeth for the completion of the preparation and the restoration task and the technical skills day. All right. So these teeth are basically called the new platinum range teeth, are compatible with existing models and aim to provide candidates with an improved and more realistic simulation experience. Unfortunately, you don't have these teeth available right now. There are two main suppliers that the candidates buy from. One is Navada in Mumbai and one is One Dental in Sydney. At this moment, you don't have the supply of these teeth, but once the ADC start to introduce them, they might have the supply for the candidates to purchase from these two recruited suppliers for their practice when they are practicing at the home setup for the ADC tasks. All right. So what the ADC says is that they have specifically been engineered to deliver improved tactile feedback, uniform cutting response, and optimal aesthetics. So basically, it doesn't mean that a task is going to be changed. The way that you need to do the task is going to change, but of course, it will give you a more realistic feeling on how the teeth are when you're doing these tasks on actual patient, like when you're doing composite cavity preparation or restoration. Maybe the feel of this teeth will change. It will be more of a transition from enamel to dentine, which means as the enamel is harder, the dentine is a bit softer than enamel. So you'll have these changes blended into these new platinum range teeth. All right. Other change, feedback on practical examination performance. Now, this is basically a major change. All right. And why I say that is because a lot of candidates, when they do the practical examination, and this changes in regards to the technical skills day. The technical skills day has 6 tasks, 3 restoration tasks, 3 preparation tasks. So sometimes you fail the task without you knowing what went wrong. So what the ADC is going to do is that from period 1 2026, candidate will receive a feedback report for the task completed in the simulation clinic on the technical skill day of the practical examination for general dentists. The report will contain details of the marking rubric criteria that have been assessed as unsatisfactory, where the overall score for the task is a fail. A copy of the report, including information on how to read the feedback, is available on our website here. So ADC has those details. And the report will be available by close of business day on the same day when the results are released. All right. So what it says basically, on the technical skills day, where you have 6 tasks to perform on the mannequin, right? 3 preparation and 3 restoration. So if you look at the ADC handbook here, now this is the technical task marking rubrics, right? And this is the unsatisfactory column. So if you did the task and if any of the marking rubrics falls under unsatisfactory, if any of these points do exist, because ADC has given these for each task, right? So if you see here, each task, ADC has a marking rubric, right? And it has 4 categories: very good, satisfactory, borderline, and unsatisfactory. So let's say candidate did the A proximal resin composite preparation and they got a fail grade. So ADC will tell you the reason for the fail if it falls under any of these unsatisfactory categories, right? And the same goes for metal ceramic crown preparation. If you fail the task because you have done something of the marking rubrics which falls within the unsatisfactory points of the ADC handbook, you will have that given to you in the report card. All right. So this is a significant change because for years ADC released the results and the candidates never knew what went wrong. So if your task, like it says that the report will contain details of the marking rubric criteria that have been assessed as unsatisfactory. So if any of the marking rubric criteria that has been assessed as unsatisfactory, and the overall score for the task is a fail. So you will have that unsatisfactory scoring point mentioned to you in your detailed report card. All right, but this change has been only implemented for the technical day task. It has not been implemented on the clinical day, where you have 6 communication tasks and 4 clinical OSCEs, all right, or technical OSCEs. So this is just the technical day, where you have to perform 6 tasks on the mannequin, the preparation and the restoration. If you score anything, any of the points within the unsatisfactory section of the ADC practical examination handbook, you will have that mentioned in your result card. All right. Now you have the other change which has already been into effect in the ADC for the practical exam. What it says is that as a result of the feedback received from the candidates, we are providing some additional explanation about critical errors and how these are reported to candidates. Critical errors occur when a candidate performs either an incorrect procedure or a correct procedure at an incorrect site. All right. While a critical error may not lead to an overall failure for the cluster that is being assessed, it does lead to a fail score for the task or station where the error was made, because you are being marked on a cluster. So for example, if you're doing a preparation task, there are 3 preparation tasks on the technical day, right? So if you have a critical error in one of the tasks, it doesn't mean that you have failed the cluster as a whole, because at the end of the day, passing the cluster is important rather than passing each and every station, right? So you will have this mentioned to you on the technical skills day, and each of the technical skills tasks that you do. For example, it says critical errors. What are critical errors? An incorrect procedure or a correct procedure at an incorrect site. For example, you were asked to do metal ceramic crown preparation on, let's say, tooth number 4-6, all right? But you instead did endo-access cavity preparation. So that's an incorrect procedure, right? Although the endo-access cavity might be beautiful, but again, it's an incorrect procedure. So that's a critical error. Or a correct procedure at an incorrect site. So you were asked to do a crown preparation, metal ceramic PFM crown preparation on tooth 4-6, but instead you did it on 3-6. So the procedure is correct, but the site is not right. So again, it's a critical error, and critical error means that the task is failed. Okay. So it says candidates who fail a station or task because they have made a critical error will be able to see that reflected in the statement of results. Pass, fail, or fail critical error. So pass means that you have passed the task. Fail means that you have failed the task, but you have not failed because of critical error. You have failed because you have not satisfied the marking rubrics. All right. And then comes on fail because of critical error, which means that you failed because you did any of these 2 mistakes, an incorrect procedure or a correct procedure at an incorrect site. All right. And then it goes on to say, please note that a critical error is not the sole reason why a candidate may receive a fail score for a station. It is possible for a candidate to fail a station or task without making a critical error if they do not demonstrate the minimum level of competence required, which, like I said in the second point here, that you're failing, but you're not failing because of critical error. You're failing because you did not do the task properly. All right. And if any of the unsatisfactory points are there in the task that you did, it will be also reflected onto that task result, right? As mentioned previously. So they're going to mention to you if you make any unsatisfactory marking rubric point for any task of the technical skills day. All right. And then another major change, which is the updates to the practical examination infection prevention and control marking rubric. The infection control marking rubric for all dental profession has been revised, and the ADC is making it publicly available to all candidates. This is there on the ADC website. We are publishing the marking rubric to help candidates better understand the standards of assessing infection prevention and control, and to prepare for the practical examination and for the practice in the Australian context. So how things work as a dentist when you're practicing in Australia, what measures we follow on a daily day practice with the patients, right? And you can find the infection prevention and control marking rubric in the general dentistry practical examination handbook. So yes, if you scroll down here at the end, once you are done with the technical skills marking rubrics, you have the communication OSCE marking rubric, and then this is the change that they have made. So they have actually mentioned the infection control marking rubric and what they are looking for. All right. appropriate clinical presentation and attire. So it says what they are looking for, PPE worn and removal in the correct sequence, what they're looking for, hand washing, they have told you what they're looking for, alcohol based rub, they have mentioned what they're looking for. This is a huge help because there was always ambiguity amongst the candidates. Okay, what should we do? Although we had all these points already covered in the practical examination course that we run, but now ADC had made it strictly available in the marking rubric. Like, this is exactly what we want. All right. Because we always used to follow this sequence in the course that we run for the practical examination. So some candidates used to tell us that, someone is telling us this and that. So why are you saying this? Now they will realize why we are saying this, because now the ADC has actually said, and we had exactly this in our practical examination course, even before ADC gave further clarification and released the marking rubric for the infection control. All right. So this is a major change. And then what it says, so what else will change? Starting January 2026, general dentistry candidates will also be specifically instructed to demonstrate hand washing at one technical OSCE station during the clinical skills examination day. For all the other technical OSCE, candidates will have the choice of hand washing or using alcohol-based hand rub. So it says that now you will be asked to demonstrate hand washing at only one technical OSCE, because there are 4 technical OSCE. You'll be asked to demonstrate only at one, and for the remaining technical OSCEs, you will have a choice to either do hand washing or alcohol-based hand rub. So that means ADC has perfectly made it acceptable that you don't need to do hand washing at every technical OSCE station. They will tell you where they want to see you do the hand wash. Candidates should note that the criteria shared in the marking rubric are those that are common across all technical OSCE stations, which means that this, what they have shared here, they are common across all the technical OSCEs, the 4 technical OSCEs that you have on the clinical skills day of the practical exam. Individual OSCE station may have additional infection control criteria specifically relevant to the task, which are not included in the publicly available information. What this means is that this is common that you need to follow. This is what you're seeing in the Appendix C, infection control marking rubric. This is common for all technical OSCEs. Now here it goes on to say there might be other additional infection control criteria which you also need to present in the technical OSCEs, which are not included here. So what do they mean by this? For example, you're doing a local anesthesia technical OSCE. They want you to see the sharps management that you follow. All right. That's not there. That's not here in the infection control marking rubric, right? So that's why they said that will be relevant to the individual OSCE stations, depending upon that station. So for example, if you have a LA local anesthesia task, so whether it's infiltration, buccal, or whatever it is, they will be expecting you to see how you're managing your sharps, and so on for the other technical OSCEs, whatever infection control procedure might be relevant to those. All right. So yes, this was really important, very helpful change from the ADC side. And I would say everything and all the changes that they have made are actually in favor of the candidates. All right. So please be prepared, prepare well, read the ADC practical examination handbook. All those candidates who are worried about the changes, please watch this video. It's going to give you explanation on what the changes actually mean. All right. Thank you.